The process sounds straightforward. Your doctor prescribes a medication, your pharmacy fills it, your insurance company pays for part of it, and you pick it up. The reality, though, is anything but simple. Medications are a complicated web of costs involving manufacturers, pharmacy benefit managers, insurance companies, and more.
It's very complex. Everything about prescription drugs is tied to who's paying for the drugs.
The result?
We've seen incredible increases with the cost of medications.
So let's take a closer look at that web. It starts with the drug maker who researches, manufactures, and markets a medication, then sets a price. Pharmacy benefit managers who work for insurance companies and others then negotiate with those drug makers for a rebate, but
They make a profit just like all businesses. So some of the criticisms of pharmacy benefit managers are that they also get rebates and things with their negotiations.
that's where the formulary comes in. It's a list of prescriptions your insurance company covers. The tiers determine how much the patient pays for medications and how much the insurance company will cover. Rebates help decide where a medication is placed on that formulary.
This is the nature of the beast.
Pharmacies are then left to deal with the patients.
I'm still going to be crazy next week.
Jen Palazzolo owns Flatirons Pharmacy in Longmont.
We really try to be alert and conscious of what the price tag is before it, is over there waiting to be picked up, and then the patient has sticker shock.
She says they do their best, but the system is a mess.
Now I'm kind of thinking of like a melting ice cream cone. You start with this like nice rich scoop of ice cream at the top and it starts melting. Then like what you're left with is just something that nobody knows what to do with this like melted blob of ice cream. And so the pharmacy, the one who delivers the medication, is left to figure out, okay, like what do we do with this mess that we're left with?
Over the years, Colorado has tried to deal with drug prices. In 2019, they passed a law to look into importing medications from Canada. However,
We have not been able to implement that because we needed a waiver from Health and Human Services, and that has not been granted to Colorado.
last legislative session, they tried for more transparency.
Because the problem right now is nobody really knows what's happening.
Representative Dominique Jackson co-sponsored 2 bills to better understand drug pricing, the rebate process, and the players involved.
This, to my knowledge, will be the very first piece of legislation that will look at the entire supply chain and how everybody interacts with everybody.
Poll the members of the committee.
But then COVID came and legislative priorities shifted with a difficult budget. This upcoming session, a renewed push.
I'm proposing a bill in January that will allow us to assess drug price increases.
But Senator-elect Sonia Jaquez Lewis says she is expecting pushback.
Patients pay very high prices, and they have for many years.
There's
although
even
we
been
brought it
efforts on a
down.
federal level to rein in drug prices. For now, though, that tangled web of medication costs is as convoluted as ever.
It is one of the most complicated systems in the health field right now.
Megan Lopez, Denver 7.